Welcome back to the KN Education YouTube channel. So in this video we will discuss about the brain circulation and where it exactly given to the different parts of the brain, okay, or different lobes of the brain. So in this what you are seeing, that will be the exact thing of the brain circulatory arteries, but I will tell you the easy way how to write this brain circulation arteries. Okay, so first you take the brand that is inverted y. This is inverted y. Okay, you written inverted y. Next you write the vertical y. This is the vertical or standing y. Okay, in the side you write okay, in the side another y. This one is another y, and here also another y. Clear? So after writing that, make a line, and from that y, okay, from that y. Clear? And after writing all these things, you write 1 2 3 4 5, okay, 5 pontine arteries, and afterwards you can write the two lines like this. Okay, and later on this one you need to join this side. Okay, you have to join this side, and you erase this one. Which one? You erase this one. Okay, yes, here. Okay, after writing this one, from here one sorry, here one yes and another one yes. Okay, so this has to be connected this side. Clear? And later on you have to make to the a, you make a for this. Okay, what is this? A. Okay, this one is the a. Clear? And you make the small arteries that is coming out from the s, isn't it? Clear? So only this much. If you write this much, you will understand easily. So now, so see here, first you write what? You write the vertebral arteries. What is this? Vertebral arteries. Vertebral arteries is joining to form what? It will joins to form a basilar artery. This one is a basilar artery. Clear? Vertebral arteries and basilar artery. Clear? Okay, next, so this vertebral arteries in the anterior aspect, it will gives off the branch to the standing y. That standing y or a vertical y is a anterior spinal artery. This is the anterior spinal artery. Sir, then posterior spinal artery, it will be there, but it will comes this side, this y. Okay, this one is the cerebellar. Okay, to the cerebellum, it is giving to the cerebellum, that is posterior aspect of the inferior, posterior and to the inferior aspect. Okay, back side and down side of the cerebellum, it is giving branch, and from that branch we will get the posterior spinal artery. What is this? Posterior spinal artery. Clear? Okay, so this is the posterior inferior cerebellar artery, and this one is the posterior spinal artery. You can call this one as pica. Pica means what? Posterior inferior cerebellar artery, cerebellum. Okay, cerebellar artery. This one is posterior spinal artery. This one is the anterior spinal artery. Clear? This one is the vertebral arteries. And what I said, this one? Basilar artery. Clear? Okay. So this one is the pica, this one is ica. What is this? This one is the ica. Okay. So ica means what? Anterior inferior cerebellar artery. So for the anterior also, anterior aspect of the cerebellum and posterior aspect of the cerebellum, both. Okay, anterior aspect and posterior aspect of the cerebellum, both at inferior aspect. Okay, posterior inferior and anterior inferior cerebellar artery. Clear? From it labyrinthine artery will be there. What is this? Labyrinthine artery. This one is labyrinthine artery. Clear? And 5 you write 5 what? 5 pontine arteries. Okay, 5 pontine artery. Okay, 4 5 pontine artery. What is this? Pontine arteries. Clear? Later on you write 2 arteries. Okay, this one is related to the superior aspect of the cerebellum. Okay, superior cerebellar artery, and this one is the what? This one is the posterior cerebrum. Okay, for the posterior cerebrum, for this. Okay, posterior cerebrum artery, cerebral artery. See, one thing I would like to say, for the cerebellum, see, I will write here, this one is the temporal lobe, this one is the frontal lobe, and this one is the parietal occipital, isn't it? It will continues like this, isn't it? This is lateral sulcus. So here what happens, here there is a presence of central sulcus, so we will discuss that one also later on. Okay, occipito-parietal sulcus. This one is the occipital lobe, this one is the parietal lobe, this is frontal lobe and lateral lobe, temporal lobe. So here posterior cerebral artery is cerebral. This one, whatever the arteries is supplying to this aspect, we will call it as cerebral. This one is cerebral. Then cerebellar means which is present beneath the what? Beneath of the occipital, and there is a presence of what? Pons and medulla oblongata, and this one is the spinal cord, isn't it? Clear? So here pons, this area, this is the posterior inferior cerebellar. This one is the cerebellar. What is this? Cerebellar artery. Cerebellar artery is supplying. Where the arteries are coming from, it is showing that. So vertebral arteries are coming anterior aspect of the medulla oblongata. It is coming anterior aspect of the medulla oblongata. Where exactly it is coming? It is coming near to the medulla oblongata. Where it is present? Actually it is present in, it is coming from the back side, that is vertebral transverse of the cervical vertebrae. Okay, cervical vertebrae, that foramen will be there na, from that foramen it is coming and entering into the foramen magnum. Okay, so it will near to where medulla oblongata it will enters. Okay, later on it will forms a common artery called basilar artery. Basilar artery, where it is there? Basilar artery is present in front of the pons. In front of the pons there is a presence of basilar artery. This overall will be called as basilar artery. Okay, this basilar artery is present anterior aspect of the pons. So that's why the branches which is coming from the basilar artery, they are called what? Pontine arteries. What I said? Pontine artery. Okay, pontine artery. This one is the this one is what? Superficial. Okay, superficial or superior cerebellar. Okay, cerebellar artery. Okay, for the cerebellum it is giving, that's why it is called posterior cerebellum. So after this one here finish, up to here it will finish. Okay, later on. So next is the very important thing for the circle of Willis. Posterior cerebral artery, this one, this area. Okay, posterior cerebral. Okay, posterior cerebral artery. Clear? Okay, posterior cerebral artery. Next you need to connect. This is about where it is coming. It is at the foramen magnum of the skull. Okay, it is entering there. Okay, from the carotid sinus, the carotid artery is entering here. The S I am writing, this is the one S and another S I am writing here. Okay, so now I will connect. So internal carotid artery gives the branch to the posterior cerebral artery. Okay, posterior cerebral artery as a one branch. That branch name is called posterior communicating artery. What you call posterior communicating artery. Clear? Okay. So later on it will give the another branch called anterior cerebral artery. It will give the anterior cerebral artery. See, anterior cerebral artery. Okay, this one is the anterior cerebral artery. Now these two anterior cerebral artery will communicate each other. So it will gives the communicating, okay, that is communicating, we will call it as anteriorly it is communicating, anterior communicating artery. Clear? So this is what I need to say, and this one is the continuation of the internal carotid artery, that is middle cerebral artery. Okay, middle cerebral artery. So one by one I will write the names. Now you can understand this diagram. Clear? Okay. So now I will write one by one the names of the everything. Okay. So firstly we have said that this one is what? Anterior spinal artery. What is this? Vertebral. These two, vertebral artery 1, vertebral artery, that is left vertebral artery. This one is right vertebral artery. Clear? Vertebral artery. Okay. Next, this one is the left, this one is the right. Okay. Left posterior spinal artery. Okay, posterior spinal artery. Next, what is this? This one is the posterior inferior cerebellar. Look at the spelling, cerebellar artery. Clear? Next, what is this? This one is the ICA means anterior inferior cerebellar artery. Okay, cerebellar artery. Next, what is this? This one is the labyrinthian artery. Okay. Next, what are these things? These things will be called as pontine artery. Okay, artery. Next, what is this? This one is the basilar artery. Clear? Next, what is this? This one is the superior cerebellar. It is cerebellar. Okay, cerebellar artery. Okay. Next, what is this? This one is the posterior cerebral. Okay, this one is cerebral artery. Okay. What is this? This is the posterior communicating artery. Okay. What is this? This one which is giving in the middle. Okay. First what happens from the internal carotid? It is coming from the down, and there is a loops will be there. When it comes from the down and enters the where? Carotid sinus. Okay. So anteriorly it enters the carotid sinus. Okay. Which one? Internal carotid artery. See, internal carotid artery, how it is enters. The external carotid artery gives off to the face. Okay. Whereas internal carotid artery directly gives the blood circulation to the brain, and it will enters into the skull. Clear? So when it enters into the skull, it will enters through the carotid sinus. Clear? And whereas this one, what I said, vertebral arteries enters with the foramen magnum of the skull. Okay. Now, so this one, firstly when it enters internal carotid artery, the first artery gives the branch is the ophthalmic artery. For the brain only I am saying. Okay, ophthalmic artery. After the ophthalmic artery, it will gives the branch, another one is posterior cerebral artery. Next, it will gives to the another one called anterior choroidal artery. What is this? Anterior. This one is not belongs to the circle of Willis, but it belongs to the brain circulation. Clear? Okay. Anterior choroidal artery. Okay, so why it is anterior choroidal artery? Anterior choroidal artery gives to the choroid plexus of the lateral ventricles. Okay, this one is the middle cerebral artery. This one is the, these two are internal carotid artery. Clear? Okay, this one is the what? Anterior communicating artery. Clear? Okay, what is this? This one is the anterior cerebral artery. Okay, so it will be divided as anterior cerebral artery also coming gives of see the internal carotid artery gives the branch to the posterior communicating artery, but internal carotid artery will stop or it will terminates by giving of two branches. One which is given to the anterior aspect will be called as anterior cerebral artery. One which is given to the middle aspect to the lateral aspect, so that one will be called as middle cerebral artery. This middle cerebral artery is the continuation of the internal carotid artery, where the exact the termination will occurs means the two terminal branches. Anterior cerebral artery is a small artery, whereas middle cerebral artery is a large artery. Clear? And it is not a branch, it will divides, it will bifurcate into two, and small anterior cerebral artery and medium size, that is middle cerebral artery. Clear? Okay, so middle cerebral artery, where this actually gives off. See, first I don't want to make you the extra thing. For that purpose I will practice 2 times, and after practicing it. So thank you for watching this video. In the next video we will discuss about the further things. Thanks.